Hello class, this is the presentation for Group 18 on healthcare disparities and barriers to healthcare in low-income areas for nursing 450. So introduction in this topic, the differences in access to healthcare across different populations is the main reason for existing disparities in healthcare provision. The importance of healthcare services is promoting and maintaining healthy lifestyle, preventing and treating illnesses, as well as reducing early death and achieving quality of healthcare, especially those in rural areas with multiple barriers to care. This issue is linked to the Orm theory of self-care deficit. This theory states that self-care is practice of activities that an individual initiates to perform on his or her own behalf to maintain life. Health and well-being self-care agency is conditioned by age, developmental state, life experience, and social culture orientation, health, and available resources. The healthcare disparities and barriers to healthcare in low-income areas limits the ability for these people to meet self-care needs because of lack of resources. And this care would be, lack of healthcare or healthcare insurance. This theory, states that all patients, people wish to care for themselves, but they're not able to do that when they lack resources to do so. When they cannot meet their own necessities, self-care deficit occurs. Some of the barriers to healthcare in rural areas would be lack of insurance, not enough coverage. Some people do have insurance, but they don't have enough coverage on insurance, so they have to end up paying out of their pocket. And a lot of people that don't do that or can afford to do that. Lack of services available, inability to afford care. Again, it goes back to not enough coverage or lack of insurance. Legal barriers. A lot of these low-income areas are immigrants or immigrant families, and they are more likely to have legal barriers. For example, coverage to Medicaid or Medicare, it's not available to immigrants. Structural barriers, including like lack of transportation to go to a doctor, long wait times, or inconvenient appointment times. A lot of these low-income families, they have two jobs in order to support the family, and they don't have time to go to the doctor. Lack of healthcare providers. These low-income families are usually located in like inner cities or rural areas, and the amount of providers are limited here, as well as language barriers. Non-English speaking patients may not understand the basic information to their health or their condition, or they may not understand when to seek for help and go to the doctor. The consequences of these barriers include disability, hospitalization, as well as increased complications, emotional and financial burdens, as well as delay in healthcare.
Position statement: access to quality healthcare services is a basic human right. Safe and effective healthcare services should be available to everyone, regardless of race, ethnicity, socioeconomic, or insurance status. The goal of any future healthcare policy should be to end healthcare disparities, not merely reduce them.
Hi, my name is Lydia, and I am covering the proposed action and public awareness portion of this presentation. So as a group, for this project for barriers to healthcare, we chose to write a statement to our state legislator, who is Senator Atkins. And so I'm just going to read the letter that we put together. So, dear Senator Atkins, we are writing to you as a group of registered nurses from California State University, San Marcos, with the following concern. Within our training as professional nurse leaders, we have identified barriers to healthcare which prevent those with low income to adequately obtain timely and effective outpatient primary care services. The consequences of delayed or inadequate medical checkups are an increased utilization of more costly emergency medical services and poor health outcomes for patients. With this in mind, we would like to make a proposition in which the federal government offer financial incentives to advanced practice nurses who are willing to work in underserved communities of the United States. Research has proven that nurse practitioners are indispensable primary care providers whose ability to treat a wide variety of conditions rivals that of physicians. Expanding their practice throughout the U.S. will help close the primary care gap. As 22 states have already adopted this model, we urge you to consider implementing this practice in the state of California, where healthcare needs are increasing on a daily basis. Providing more advanced practice nurses in low-income communities will make a big impact on neighborhoods that rely on medical interventions for chronic diseases. Not only will this improve health outcomes for more people, it will also decrease the gaps in healthcare and provide insight on how to appropriately train future clinicians who wish to practice in underserved regions. As nurses practicing in acute care settings where we see a lot of patients who reside in low-income neighborhoods, it would help us offer patients guidance for follow-up care when we know there are adequate primary care clinics accessible to them. Please feel free to reach out to us should you or your staff have any questions or need additional information. Sincerely, Group 18, which is composed of Lydia Wellheim, Julio Alvarez, Yuki Hong, Andrea Soriano, and Dania Tenori. And so this was the letter that we proposed. Hopefully it will decrease some of the barriers to healthcare for those with obstacles such as transportation, no health insurance to primary care, etc. Thanks.
Hi everyone, my name is Andrea and I will be discussing about the relevance to nursing leadership. So first off, some of the things that we discussed earlier in regards to the healthcare disparities include the lack of healthcare, the lack of insurance, the lack of financial stability, and the different diverse populations in these areas of low income and rural areas. So first, nursing leaders must focus their efforts on eliminating disparities within the quality of care and also within the clinical setting. By using evidence-based practice, leaders must collaborate to increase awareness about healthcare disparities with other healthcare professionals and advocate for continued action. So some of the ways that we can advocate and increase awareness are by taking it to the governmental level, writing a letter to the state legislator, and also being creative and helping strengthen the healthcare system. And also not to forget the standards and guidelines that are in place. So by implementing policies, for example, the Healthy People 2020, we can continue to increase awareness for those. Other things is that nursing leaders should engage in research. We should generate our own evidence, track our own data, and share it in order to improve issues that we see. We can also take a look at the nursing education. We can question if education is universal. Does it meet all the demands for the different populations, the ages, and socioeconomic statuses? Or is it something that we can address and improve? Also, the workforce should reflect patient diverse backgrounds. So we should learn and practice cultural competent care. We touch on that in school, but is it carried over to everyday reality and to life? Again, interprofessional collaboration. We shouldn't just keep our issues or the problems that we find as nurses within the nursing community. We should bring it up with our board members and also the physicians that we work with, so that everybody is on board with our advocacy. And then also, as nurses, we should be able to empower every healthcare professional that we work with. Just because you are a charge nurse or a supervisor doesn't make you the only person that can be a leader. We should empower all the staff members to make decisions and be a leader within themselves, so that the workforce just is completely different. And lastly is to be able to bring up the issues to the committees and the board members. It's not enough just to show up to work and expect a change within our healthcare system. We should become board members and sit in the committee meetings and voice our opinions in order to be heard. And those are just some of the things that are relevant to the nursing leadership.
Interview. 2 interviews were conducted for this project in order to gain different perspectives on the issue from 2 healthcare professionals working to end healthcare disparities within low-income sectors of San Diego. The interviewees included Sunny Smith, MD, co-director of UCSD's student-run free clinic. Her focus of care is in helping the homeless and destitute population. And Amber Calvin, MSN, RN, PHN. She's an ICU nurse and member of the American Public Health Association and member of the Committee to End Healthcare Disparities in California. Her focus of care is on educating and helping the poor and immigrant populations. The following questions were asked and addressed during the interviews. 1, what do you feel are the biggest obstacles to healthcare access for low-income populations? 2, what do you feel the government should be doing to close the healthcare disparity gap? 3, do you think increasing access to preventative services will help decrease the prevalence of certain chronic conditions in the most vulnerable and at-risk populations? 4, do you believe community healthcare access should be reformed? Why and how so? Number 5, do you feel that enough focus is placed on preventative medicine in low-income communities? 6, what can healthcare providers do now to try to bridge the gap in healthcare access? 7, who do you feel are the most vulnerable and at-risk populations you serve and why? The interview transcripts can be found on Appendix A on the hyperlink. Both interviewees agreed on the following points. Number 1, greater funding is needed for preventative health care programs and community clinics. Also, one must assess the social determinants of health in order to work on improving the community's overall health status. People of lower socioeconomic status are the most affected by healthcare disparities. Also, education is key. Another point that they mentioned was that we should be involved as healthcare professionals, and all healthcare professionals should get involved in affecting policy in order to make change.
Hi, this is for group 18. My part is a conclusion. Here's several principles should be considered. First one is professionalism. The work related to the provision of healthcare services should be distinguished between what the specialist should do and what the non-specialist should do. This is time-consuming, and more efficiency of health services can be improved, and the quality of services can be secured too. Second one is accessibility. This means how low-income residents can afford healthcare services. There are many obstacles to accessing healthcare services. Let's say there are lack of information about healthcare service, and also geographical, such as traffic, distance, and psychological too. Fear of exposing patients' own problems. The current healthcare service is to find low-income residents if they need them. This is not for low-income residents, but for the convenience of providers. The most important thing is providing and using services is to improve the satisfaction of low-income residents. Service delivery system should be organized so that low-income residents can easily contact organizations and institutions that provide healthcare service. Last one is participation of local residents. It's important for healthcare people to be involved in providing service for their who had lived in that area for a long time. We need to gather their opinions and develop services that are familiar with that community. Low-income residents can be provided with the services they really need, which will increase the satisfaction of local residents and increase the efficiency of services.